All right, hey there. This is Teresa here, and today we are going over a case study reviewing one of my favorite flap repair options for a small to medium-sized Mohs nasal defect to the lower portion of the nose. In this case study here, you can see that the nasal defect is located in the left superior ala. Now, when choosing a repair option for a Mohs nasal defect, the questions you want to ask yourself are the following. Number one, which flap design would be best and be able to stay on one side of the nose, respecting your cosmetic units? Two, where can I place my incisions so that the scar will be less noticeable with time? Three, how can I repair this the best aesthetic way, being mindful to not distort the nose? And four, how can I preserve the nasal valve to prevent occlusion? So, with all those in mind, I chose the Rhombic Flap repair. This is one of my favorite workhorse flaps that I choose for small to medium-sized defects located on the lower portion of the nose. So, in yellow, you can see that this is how I designed it. I kept the repair on one side of the nose because usually if you're staying on the same area or unit of the nose opposed to crossing over those subunits, cosmesis is better. Also, you always want to anticipate where the dog ear is going to be removed to allow for optimal movement of the flap into the defect. And with this design, I actually appreciated the fact that I was able to position the dog ear, as you can see, located in the alar crease. Again, scars heal much better when hidden in creases. And as far as symmetry of the nose, you will see on the next slide how we were able to preserve that. Lastly, during the repair and movement of the flap, while you are performing it, always ask the patient throughout to breathe in and breathe out while you are occluding the other nostril to ensure you are testing the valve and ensuring that you're not occluding it. Again, do this multiple times during the procedure because each suture that you place and any tension or movement of any tissue can potentially push down on that valve. And in this case, his valve was undisturbed and he was breathing well. And here is a picture of the cosmetic units and junction lines for the nose that I want you to embed in your head when performing your repairs on the nose or assisting your Mohs surgeon in performing the repair. And in this slide, here are the incisions and the removal of the dog ear located on the alar crease. And for this flap, the flap relies on the blood supply through the subdermal plexus. This is located at the junction between the reticular dermis and the subcutaneous layer. So undermining was performed subcutaneously and the flap was raised, preserving this plane. The flap was then transposed into the defect. Here, what you are looking for is when you move that flap into the defect, you are anticipating how that tissue is going to move and how it is going to affect the surrounding structures of the nose. Because again, the goal is, number one, keep the design on one side of the nose if you can, respecting your cosmetic units. Two, placing your incisions in the area where the scar is less noticeable, again, creases and curves. Keep the nose symmetrical, no distortion. And number four, preserve that valve. So in this picture, the flap was trimmed to fit the defect. 5-0 Vicryl was used for deeps, 6-0 Prolene for tops, and of note, a tacking suture was actually placed, tacking down the underside of the flap into the bed of the defect to help lift the left ala back up and preserve the valve. This technique is a nice technique to use when you want to make sure the flap is attached to the wound bed and not leaving an empty space. And here is a visual of what you want to look for when you're performing this repair. always visualize all angles of the nose, but in this slide in particular, this slide specifically shows you what the inferior view looks like when you're performing the repair and when you're performing it. Note on the left nair, there is no occlusion and the patency is maintained. And when you're looking at it, you'll see that there is a subtle pull where the nose is pulling towards the left. This will resolve with time. Reassure the patient that when the anesthesia resolves and when the swelling goes down with time, this pull will resolve. However, have your patient always follow up with you to ensure they are healing as expected, and setting those patient expectations on what the outcomes are supposed to look like are important. For flaps, I usually do 1 month and 3 months follow-up. Okay, well, hopefully this quick video helped you better understand what a rhombic flap is, how to utilize it for a repair option for a Mohs nasal defect. Next time you reconstruct or you assist your Mohs surgeon with a nasal defect, remember this video and the tips I shared with you. Now, if you're a dermatology NPPA and you found this information helpful, join our free community on Facebook and take a look at my website where you'll find more information on future courses coming soon. All that information will be in the description box for this video below, and thanks again for watching.